Let's see.
Hi, everyone. Good morning. It is an absolute pleasure and honor to be able to speak with you all today. I am the program director of this grant and network, and I'm already in awe and so a bit speechless from what I've already heard this morning, the possibilities. I was reaching around for a notebook. I wanted to write some things down, and so I'll escape for a moment in between. But I'd like to give you an overview today about National Institute on Aging, and to talk to you about some opportunities for you all. I'm going to share my screen, if successful. Let's see here. So let's see. Here you go. Everyone see okay?
Oh.
Yes?
No. No, not yet.
My apologies.
No, no problem. Maybe going down to the green share screen button. Sarah, does she have, she has approval to share? Okay, good.
It's generally super easy when practiced outside of the context of a meeting. So, let's see here. Let's see. Oh, it says one participant can share. Okay. Very good. Okay. Sorry, I've also got here.
Sarah, is it possible that you're still, oh, there we go. Good, perfect.
Yes,
that's working, yes.
Terrific. All right, and so so I'll tell you a little bit about National Institute on Aging today. And so before I start, though, I want to take a moment to acknowledge what I believe is our collective pain and outrage at tragic events and injustices that have been and have led and are leading to deaths and maltreatment of countless people. And there's an inordinate amount of work that remains to be done to be able to eradicate this entrenched racism and inequities in our society. And there's a need for National Institute on Aging for great reflection about how we and how you within your network can contribute to bringing about meaningful change. And I am just so grateful for this opportunity that we have before us today. So thank you for allowing me this moment. I have way too many slides, but the good news is that I don't have to talk about everything that's on the slides, and I'm happy to share any of the information afterwards with anybody who's interested. Feel free to interrupt me during my presentation. It's not interruption, it's participation. And so, and to contact me afterwards if anyone has any questions at all. And so, let's see here. So what I'm going to talk to you today about the ARCH and the NIH Mission together, and the strategic directions for research at National Institute on Aging, and our broad strategic directions for research. I'll talk to you about our programmatic interests and current funding priorities, of possible relevance to research with criminal justice populations, and where to find these on your own. And then I'm going to share some thoughts about some research topic areas that could be of interest to NIA that you all can bring about, and a few tips for applicants that may not be so easily Googleable. All right, and then I'm going to close my presentation by telling you some awesome NIA supported resources and opportunities that members of your research network maybe wish to consider pursuing. All right, so moving to the NIA mission and strategic directions for research. Our mission is to support and conduct genetic, biological, clinical, behavioral, social, and economic research on aging, to foster the development of research and clinical scientists in aging and provide research resources, and to disseminate information about aging and advances in research to the public, healthcare professionals, and the scientific community, among a variety of other audiences. And so what do we mean by aging? I'd like to clarify that NIA refers to that as aging processes, diseases, and conditions associated with aging, and other special problems and needs of older Americans. And these include aging processes and experiences that impact health. And this could be physical health, this could be psychological, mental health, and well-being in middle-aged and older adults. And so we're interested, since we're interested in aging, this includes exposures that early in life one experienced that contributes to aging outcomes. And so where does NIH consider this work to fit in? Just about anywhere, but a very obvious place, unfortunately, is in health disparities research. And so there are, and so what does NIH consider health disparities to be? These are differences in any health-related factor, again, and I'm going to say physical and mental, psychological health factor. And this could be in disease burden, diagnosis, response to treatment, quality of life, health behaviors, and access to care. And these are just a few that exist among various population groups. And so NIA recognizes that health disparities are associated with broad, complex, interrelated array of factors. And so while NIA considers health disparities a cross-cutting theme, we have actually our own goal in NIA's strategic direction that are focused on, this is goal F, understand health disparities related to aging, and to develop strategies to improve the health status of older adults in diverse population. And so we have the NIA, this is the NIA Health Disparities Research Framework. Anything you see, you can find on the National Institute on Aging webpage via Google. And so when you hear these keywords, look those up and you'll find them, or reach out to me to find these things. And so this, we could spend years going over, but what I want you to focus on, priority populations. You're not going to see, for example, criminally involved individuals listed on this. Health and Human Services includes that with among the vulnerable populations. But this is implicit because we can see many different categories that are intersecting with the population that we're focused on here today. And so we think of it in terms of environmental, sociocultural, behavioral, and biological types of intersections. Those are the 4 different types of analyses, and they can intersect with one another. All right, let's see here. And so I want to turn to some priorities and funding opportunities. And so NIA topics of relevant current, relevant current funding announcements. We've got a lot now going on with COVID-19, I'm happy to say. I'm going to talk mostly about the Division of Behavioral Social Research, because that's where the network is supported, and that's where I work. And so this is our heyday now. To be looking at things, and I'll point things out. So there's a link at the bottom that will point you to these. You just enter these keywords. Alzheimer's disease and related dementias is a major area for us these days. Social determinants of health is of interest, and science of behavior change and intervention design, and science of social justice. I'm putting that out there. And this is more of a TBD. We need to figure this out, and we are motivated, and that is of interest to us to understand this better. And again, this is I'm talking about behavioral and social science research that would lend itself to these questions here. So let me give you just a very few examples that may be of interest to you. So we've got a notice out there on social, ethical, and behavioral implications of COVID-19 testing among underserved or vulnerable populations across the US through, if you've heard of the RADx and RADx Up initiative, this is the Rapid Acceleration of Diagnostics for Underserved Populations. I think this would be a tremendous opportunity. We've got the NIA multi-site COVID-19 related clinical trial implementation grant on aging-related topics in our older adult populations. And we've got administrative supplements and competitive revisions. There are many. For you to be able to apply for administrative supplement or competitive revision, you need to be attached to a funded grant as the principal investigator. And so you can join them, but you on their projects, that your collaborative projects, or if you have your own NIH grant, I should point out. There are lots more. I'm just highlighting just a few, and again, giving you some ideas of where you can go, again, on our website or NIH's. Currently, we've got 73 active funding announcements in Alzheimer's disease and related dementia. All right, and so I'm not going to go over all of them, but that means that they're not just focused on them, but it's mentioned at least in these announcements. We've got an announcement on examining diversity, recruitment, and retention in aging research that could be of interest. Also of interest to some of the early stage investigators or new investigators or new to this area investigator. We've got the Small Research Grant Program for the next generation of researchers in Alzheimer's disease and related dementias. And so there are existing data sets I heard mentioned earlier that can be used to look at secondary analysis, which could provide preliminary signals for a larger grant. And so and for archiving these data that I would recommend. All right. And so in terms of the areas of interest, going back, I guess, to COVID-19, here are some of the areas of interest. I don't want to take up too much of our time here when you can be reading this on your own. And so you can look at these different areas, and I'm, again, happy to answer any questions. Also, I do want to mention, however, that in terms of facilitating sharing of COVID-19 survey data items, we've got at NIH, this was the group with the Office of Behavior and Social Science Research that worked with members from my division and to make existing COVID-19 survey items and investigator contact info available in a survey and item repository. The idea is to be able to harmonize data sets, to be able to have comparative analyses. I think that would be a very important resource. And there's the Thanks Cool toolkit, which has Phoenix toolkit, which has COVID-19 related measurement protocols. All right. And so COVID-19 and health disparities and vulnerable populations. And so we've got several announcements that are focused in this area. So there are many opportunities for you to pursue. And so in terms of Alzheimer's disease and Alzheimer's disease related dementias, as I mentioned, this is a major area. In some cases, you had four times greater chance of getting funded if your work was on Alzheimer's disease and related dementias than if it wasn't. So this is unfortunately a growing area because of the growing needs. And so these are different topic areas that are of interest to our division. And so dementia care, caregiving research. So some of the many topics that I heard you all mentioning, this is directly, of interest to us. And so behavioral and social pathways, early psychological changes, prevention, disparities, and research resources. And again, with respect to disparities, this could be in any of these topic areas. That's cross-cutting any of the topics. All right. And so what do we want? So in terms of our programmatic interests, let me break this down. And so what we supported our division is social, behavioral, and economic research and training on aging processes at the individual, dyadic, group, population, societal levels. And so the research that we support is research that elucidates pathways by which social, psychological, economic, and behavioral factors affect health. We're interested in identifying these causal mechanisms. So what would be the causal effect? What is a contributor to these later life outcomes? And so for whatever these associations are that you're observing, and we're interested in targeting these mechanisms to modify individual behaviors and social contexts to promote health and and also behavior change. And so we're interested, where I say that we're not disease focused, we may disease prioritize with respect to Alzheimer's disease and related dementias, but we're interested again in aging process function, performance. And so this could also be in terms of one's social relationships. And this could be in terms of functioning in a workplace and any other type of context. And so we take a life course to studying aging processes. And so we're also interested in identifying midlife risk factors and to be able to prevent these from culminating into poor disease outcomes in later life and aging, adverse aging trajectories in terms of experiences. We're interested in promoting rigorous approaches to understanding and advancing behavior change at the level of the individual. And where it says organization, that also means institutional and structural types of levels. And we use use-inspired basic research and mechanisms-focused intervention science. All right. And so some promising research areas. This is online. I'm not going to spend your time discussing this. But this is our National Advisory Council on Aging review. And they said we did a good job. And here are some areas for us to focus more on. And I only mention this because it's of direct relevance to you all. And that is, if you take a look at the areas of recommended for focus, for future focus, you'll see at the top of the list, improve understanding of how health disparities in aging and how macro social trends influence aging. And so using a range of approaches to understand behavioral, psychological, social, and neuroscience explanation of aging. I'm not going to read all of the rest, but I am hoping you can recognize your interests within these. All right. So what might be possible for you all to pursue? There are many contexts of interest that you could be pursuing. You could be looking at optimizing clinician-patient interactions within prisons and out, and optimizing built environments for aging in place, promoting health literacy, promoting social connections and connectedness. So for those who are studying or who had mentioned solitary confinement, this is an area of interest in loneliness and the effects of this on people's health and well-being. Establish research that could better inform the establishment of care networks inside and out, and advanced care planning and end-of-life care. So tips for applicants. I would say that the take-home messages are the first, I guess, set of tips I'd like to offer you. So we know that behavioral, psychological, and social factors contribute to health trajectories and across the entire life course. And so criminal justice involved adults are facing unique challenges with aging in and outside of prison. And these are due to modifiable conditions in the environment that, that likely contribute to accelerated aging. And so behavioral and social strategy, I've got a cat in the way, my apologies. Behavioral and social strategy interventions and policy reform. This can improve the quality of care and experiences of aging and aging health and well-being. And the development of these effective interventions are going to require evidence yielded from rigorous and reproducible research. So what are some these are some common pitfalls with NIA applicants interested in these areas? I pulled up some pitfalls, I would say. And so these are risk factors for poor outcomes in NIH review of applications, is what you can think of these as. And so there's a presumption of health disparities. And this would be health disparities that you presume is the case where there hasn't been research to support it. You may be right, but there are no data to support your case. And so that data is, that's an opportunity for data collection and analysis. Limited evidence to demonstrate unique contributions of incarceration. So effects of prison on outcomes kind of questions. So again, these causal links between these experiences and outcomes. And so the unique contributions and intersecting contributions of minority stress and causal influence of stigma. This is very difficult to demonstrate. And so when written as a presumption, that's a problem when there's no evidence to support your claims. Subgroups are pooled. We know that people are not just one thing. And, you know, unfortunately, we see many different subgroups intersecting who are at heightened risk for health disparities. But to be able to parse these out, intersectionality is not adequately addressed, is a big problem. Cohort effects are mentioned, but not addressed. And so limited generalizability and impact. So there's a problem in terms of limited sample, or an applicant has not put in power analysis. There's unsupported, this is a big deal for your research group, and that is unsupported feasibility of being able to collect the data and in these hard to reach population and the subpopulations, and qualitative studies without defined next steps. So where does it go next? What is the pipeline from this qualitative analysis to something that could lead to perhaps intervention or policy change? And so that's not to say we don't support and we're not interested in qualitative analysis. We are. We also want to see in the application the next step, where this is going. All right. And so I want to finish by talking about some awesome NIA supported resources and other NIH priorities. So some of you may or may not be aware of the grants for early medical surgical specialist transition to aging research, our GEMSTAR program. And so this gives clinicians an opportunity who want to go into research to do pilot studies that can then lead to larger grants. It's a great network of their own. And a lot of people go on to receive these career development awards in aging, the BESON, so the BESON K76 program. Another great resource, I guess you could call it, here is the Resource Center for Minority Aging Research. And these are existing networks that you can intersect with. And I know that you already have begun to, the PIs here have been in contact. These are resource centers that we that we're supporting that are aiming to enhance the diversity of the aging research workforce. There's a tremendous mentoring thrust of these programs, and these are trying to mentor promising scientists from underrepresented groups for sustained careers in aging research, and also to develop like the human capital and research resource infrastructure to promote these types of advances. They support pilot studies. And so it's a great opportunity to get involved. You can hang out. They have lots of mentoring opportunities that are very, very exciting, and an annual event each year where scientists who are supported through the Rick Mars, through their pilot programs, present at these annual meetings. So if you're interested in navigating trading and career development opportunities, you go to the NIA webpage, put in NIA training, NIH, and you can look also at pathways, the K99, we call it the kangaroo, K99, which is a career development award. And then it goes into an R00, which is like an R01. All right, and so you can look that up. We have frequently asked questions there. Also, let me highlight the MDPhD training program in Alzheimer's disease and related dementias, and the behavioral social sciences, T32. We have short courses on Alzheimer's disease and related dementia for behavioral social sciences, and R25. And I really encourage you to look at the programs to diversify the research workforce. This is a tremendous opportunity to support research, research career development of people who have an opportunity to have their tuition paid. They have an opportunity to contribute to your networks or research grant projects, and to meaning they're going to pursue independent and complementary research to this. So it advances everybody's interests. I strongly recommend that you look at that. And also when you look up the word diversity, NIH and NIA in particular, we consider this very broadly. And so I encourage you to look at this. You'll see different groups of people who are eligible, and that's a short list, meaning there are other groups of people that could be considered promising in terms of their potential to diversify the work group. And so, for example, sexual and gender minorities are not mentioned, and yet they are included in this group of diversity for NIH's diversity statement. So finally, I want to just mention some administrative supplement programs. These are a few. I pulled up like 7, but not all of them are currently active. But you want to look at the Sexual Gender Minority Research Office, because every year they offer supplement money to, again, an existing grant where you can examine something about sexual and gender minority populations. You can enhance sample. Also, we do this with our Alzheimer's focused supplements, and we have a supplement program for non-Alzheimer's focused grants. And also we have research on bioethical issue supplements that NIH participates in that are opportunities to be looking at some of these questions and to attach it to this network. And so they're great opportunities. We have the Butler Williams Scholars Program for those who are interested in pursuing research careers in aging. This is a wonderful opportunity. I said the location is Bethesda, Maryland, or online, as it was this year. We had our virtual meeting, and this is an opportunity for early career researchers to really learn the ins and outs of NIA and to interact with us and very well established leading researchers have a mock peer review network, and it's a great opportunity. Finally, sign up for the NIA blog for updates. I would strongly encourage you. One, you'll get a pulse of what we are thinking at NIA, and you'll learn about our funding announcements and opportunities this way and various tips. So just, you can go to that website, go to the link, and I encourage you to read up on some of these funding blog posts. Here's a recent one that our director and deputy director, so Richard Hodis and Dr. Marie Bernard, had published on combating racial inequality in aging research. Okay, if you have questions, come to me anytime, and I'm happy to address any questions you may have. Thank you.
Thank you so much, Melissa. We are so lucky that you're able to come and join us.